Hello, and welcome to the Housing and Services Resource Center's March webinar series. Hopefully you were able to join us at the first webinar in this series entitled Expanded Opportunities with Federal Funding for Housing and Services. The webinar recording is available on the Housing and Services Resource Center at https://acl.gov/housing and services. We'll put that in the chat too. We wanted to thank you so much for joining us today and welcome you to today's session. My name is Lori Gerhard and I lead the Office of Interagency Innovation at the Administration for Community Living, an operating division within the U.S. Department of Health and Human Services. I will be serving as the facilitator for today's webinar. It's great to see so many of you here today, and with your support, we're hoping today's webinar will include an engaging discussion. Next slide. Before we get started, we have a few housekeeping items. This meeting is being recorded. By staying to participate, you are consenting to the recording. Also, all attendees' microphones have been muted for audio quality, but please know we very much want to hear from you today. Please frequently use the chat to make comments and submit your questions anytime in the Q&A feature in the Zoom dashboard. You may also email a question or comment to hsrc@acl.hhs.gov. We have reserved time to address your questions and will compile all questions to make available a frequently asked questions document. Please use the chat or email if you have technical issues, and we'll do our best to help resolve them. Next slide. So we'd like to know a little bit about who's joining us today. The work under the Housing and Services Resource Center, or HSRC, is designed to serve professionals in multiple sectors. The poll will display on the side of your screen. The poll question is, what sector is your organization in? Please select one of the responses. Health or Human Service Agency, Housing or Homelessness Services, Healthcare Provider or System, Community Development Organization, Association, Research or Advocacy Organization, Consumer or Other. And I think we need to launch the poll.
We'll need everyone to put their response into the chat.
Okay, if everybody could put their response in the chat, that would be great. Thank you. And so we'll move on to the next slide. So we'd like to overview today's agenda. While you're sending in the chat what type of organization that you're with, I want to just overview today's agenda. Today, our focus is on state and local partnerships for housing stability. You'll hear from our colleagues in Massachusetts and Washington about the partnerships and activities they are doing to help more people get and keep affordable, accessible housing with the home and community-based services and or the behavioral and mental health services that they need so they can live full lives in the community. Our intention is that you leave today's webinar with new openings for action as it relates to developing partnerships and leveraging the funding and flexibilities that are available. As you listen to these examples, please think about other organizations that you could be partnering with or innovative strategies you could replicate in your state or community. We'll then have some time, about 20 minutes, for questions and answers, and then we'll close out the webinar. After the webinar, we'll share a PDF with the slides in this presentation and some additional ones we think are helpful along with an evaluation. But before we go into today's presentation, I want to set the stage a little bit around some of the challenges we're confronting as a country related to housing. So if we go to the next slide. We are likely here today because we are all grappling with challenges we have in common. The data are quite sobering. We know that the stock of affordable units has been shrinking for many years, and competition for that limited supply of affordable rental units and rising rents makes it difficult, if not impossible, for many older adults and people with disabilities to effectively and sustainably live in the community. HUD's 2021 Worst Case Housing Report found there were only 40 affordable and available homes for every 100 extremely low income renter households nationwide. Adding to that lack of affordable housing is the fact that under 1% of U.S. housing stock is wheelchair accessible, and less than 5% can accommodate individuals with moderate mobility disabilities, making finding units that are both affordable and accessible a huge challenge. Homelessness among adults aged 51 to 61 years and 62 and older are also rising. About 1 in 4 adults in the sheltered homeless population are 62 and older. In addition, many studies have documented that finding, navigating, and obtaining services and supports for living in the community can be difficult and often challenging. However, even in states that have put in place needed community services to help people transition from institutions, the challenge of finding affordable and accessible housing becomes the issue that slows down or even prevents the transition back to the community. Next slide. So I'd like to tell you a little bit about the Housing and Services Resource Center. To address these challenges, we recognize that we need to form and facilitate greater partnerships across the disability, aging, health, and housing sectors at all levels. So the U.S. Department of Health and Human Services, specifically the Assistant Secretary for Planning and Evaluation, or ASPE, ASPE, the Administration for Community Living, or ACL, the Centers for Medicare and Medicaid Services, or CMS, and the Substance Abuse and Mental Health Services Administration, SAMHSA, SAMHSA, partnered with the U.S. Department of Housing and Urban Development, or HUD, HUD, to create the Housing and Services Resource Center. In December of 2021, the Housing and Services Resource Center launched with a website that brings together, for the first time, a wide variety of federal resources and guidance on both housing and services that support community living, including Medicaid-funded home and community-based services, behavioral health supports, vouchers, and other housing programs. You can access this information at acl.gov/housing and services. It will take all of us working together so people have access to both affordable, accessible housing and the individualized services and supports that they need to live in the community. Our shared goal is to enable all older adults, people with disabilities, those living in institutions seeking to return to the community, and people experiencing or at risk of homelessness to live stably in their homes and engage in the community. Next slide. The Housing and Services Resource Center serves as a hub for our federal partnership, and in collaboration with national, state, and local partners, we coordinate technical assistance, training, and research efforts of each agency to reach a broad audience of aging, disability, housing, health, and homeless networks and stakeholders. We facilitate partnerships between housing and service systems to expand affordable, accessible housing and access to home and community-based services and health. We recognize and share state and local innovations like you're going to hear today as an example. And we assist communities in leveraging and aligning new housing and service resources available through the American Rescue Plan. So if we go to the next slide, I think we'll summarize the poll results later, and we'll move on to the next slide. Now we'll hear about state and local partnerships that support housing stability. Let's start with our colleagues from the state of Massachusetts. It's my distinct honor and privilege to introduce Ms. Emily Cooper, who is a special advisor on housing, mass health, and the chief housing officer at the Massachusetts Executive Office of Elder Affairs. Emily, can you tell us about the exciting partnership activities in Massachusetts?
Sure, Lori, and thank you to you and to the many people who are on the webinar for inviting us and listening to us today. I think I want to highlight a a few key things about partnerships between housing and human service agencies at the state level. So the first thing is that they take patience and they take cultivation. And we at Massachusetts, and I'm sure like other states, have been working at this for quite a while. It's nice to see some success. But the successes definitely have been incremental, and we continue to work. It is sort of like a plant that you have to nourish and make sure it grows and is healthy. Some of the ways that we continue to sort of work together is always having an ongoing dialogue where we are learning from each other and even translating things. So for example, if you talk to a housing person, they're going to talk about the area median income, AMI, to figure out what housing, what income levels the housing should be at. And if you talk to a service person, they may talk about the federal benefit level. So I actually have a chart in my office where I compare 30% of area median income equals what percent of federal poverty level. So when we're in the same room and we're talking about people, we can even understand each other. So it's an ongoing relationship that we need to nourish in many ways. So we were lucky enough to participate in the CMS Innovation Acceleration Program, which is the IAP, bringing the housing and state agencies together. And what became helpful in the IAP and in general is the people. So much of this is about finding good people. You're going to hear from two of my favorite people in Massachusetts in state government who are willing to learn and to problem solve and to be flexible and to think outside the box and really to partner rather than saying this is what we do and this is what we always do. So when we participated in the CMS IAP, we were able to have high-ranking state leadership participate in the group, and that made things happen. So we had lots of results that have culminated from it. We got state money to put together a data warehouse for all the homeless management information systems. It was in 12 different places. Now we can put it all together. They created my position. So I am the special advisor on housing in the state Medicaid agency. And that came about as we started to realize, oh, we need to think about housing and other social determinants of health in the context of Medicaid, who we serve in Medicaid as well. We developed housing supports that are funded by Medicaid. We paired them with housing vouchers so that we could get the services and the housing together. We applied for federal resources together, like the Section 811 program. And we explored new permanent supportive housing models for different populations, such as pairing PACE, which you'll hear about a little bit from Susan, with affordable housing to create service-enriched housing for seniors. Or for people who are homeless and experiencing homelessness and the marketplace being what it is, we started looking at things like sponsor-based housing where an agency is renting an apartment. And that might be a more sustainable or tenable model. When the pandemic hit, we really had to rely on these partnerships in a whole new way. We had to be flexible. We had to be even more collaborative. We needed to work quicker than we ever had. And we were really able to do things together that I think strengthened our partnership. For example, we rolled out vaccine distribution through all the senior affordable housing and all the shelters in the state, which was clearly a human services housing partnership. So you're going to hear a little bit more about some of these pandemic efforts from Adam. But first, I'm going to turn things over to Susan Ciccarello, who's the acting director of the Office of Long-Term Services and Supports at Mass Health, which is the state Medicaid agency. And she's going to talk to you a little bit from that perspective about home and community-based services. So Susan, are you set?
I think I'm set. Can you hear me?
Great. Yep.
Excellent.
Take it away.
Thank you so much, Emily, and hello to everyone. As Emily just explained, my name is Susan Ciccarello, and I work for Mass Health in the Office of Long-Term Services and Supports. Mass Health is the state Medicaid agency in Massachusetts, and I want to give just a tiny bit of context of where Mass Health sits and how our programs are structured. Mass Health sits in the Executive Office of Health and Human Services. We refer to it as EOHHS. It's the largest secretariat in Massachusetts government, and it's comprised of 12 agencies, in addition to our 2 soldiers' homes and the Mass Health program. These agencies include the Executive Office of Elder Affairs, where one of Emily's hats is worn, and where we serve older residents of the Commonwealth. The Massachusetts Rehab Commission, who serves individuals of all ages with physical disabilities. The Department of Mental Health, where they serve individuals with behavioral health needs, and the Department of Developmental Services, who serves individuals with intellectual and developmental disabilities. So we have all of our little pots of agencies serving individual members, and Mass Health cuts across those agencies. And I do want to give a little bit of information about the long-term services and supports offered in Massachusetts. We are very privileged in Massachusetts to offer a very robust array of long-term services and supports to our eligible members. This includes state plan adult day health services, day habilitation services, consumer-directed personal care attendant services, adult foster care, home health, and hospice. We are far more than just nursing facilities in Massachusetts. In addition, we offer 10 home and community-based waivers, including the Moving Forward plan, and we are in the planning stages of launching an MFP demonstration. In Massachusetts, we do not require or have mandatory managed long-term services and supports, but there are options for managed long-term services and supports, including our fully integrated dual eligible special needs plans. We have 6 of those in Massachusetts. We refer to them as our senior care options programs. We also offer an MMP demo plans for our dual eligible members. We have 8 PACE programs in Massachusetts. And as Emily mentioned, the PACE program has proven to be a fantastic place to promote collaboration between with housing partners. So with everything we offer and all of our internal stakeholders, it does present some opportunities and challenges. It's when looking across everything we offer, it can be a little daunting to figure out where we need to build. So I'm going to speak a little bit to the HCBS ARPA funding and what Massachusetts did with that funding and what we are planning to do going forward. So Mass Health led an interagency effort, and when I'm talking about the interagency, I mean across the agencies at the Executive Office of Health and Human Services. So working with the Executive Office of Elder Affairs, Department of Mental Health, the Department of Developmental Services, and the Mass Rehab Commission to develop a plan for the distribution of the Section 9817 ARPA funding, that's that HCBS funding. And we really wanted to develop cross-cutting proposals to fill the gaps in our HCBS services and really shore up the HCBS system. We submitted 3 requests to CMS for a total of $1 billion in gross spend, $526 million in net spend. We've received partial approval from CMS on this and are in the process of responding to some outstanding questions that CMS has on several of our initiatives. Our initiatives focused on 3 key areas. One is retaining and building the HCBS workforce. One is access and promotion of HCBS services, and one is to strengthen the HCBS technology and infrastructure. Just like with the structure and all of this new funding, it presents us a great opportunity, but also a heavy responsibility to ensure that we are able to get the resources out quickly, effectively, and to meet really the needs of our members. So we are very, very excited to be able to leverage the relationships we have built across across both our secretariat and across state government to develop initiatives that support members to stay in their homes and support members who are homeless or housing unstable. So I do want to just highlight 3 of the initiatives that we have we've submitted to CMS, and all within different stages of implementation now. One is we are going to increase the MFP community living waiver slots. That was submitted early on in our ARPA proposals to CMS. We have also submitted a proposal around one-time transitional housing costs for members. This would include paying for security deposits, funds for furniture, and other expenses for members that can't access these resources through other resources. And the last one is coordinating and streamlining the home modification funding streams and mechanisms. Through all of our sister agencies, we have a whole bunch of ways to access home modification funding, but it is not incredibly clear to folks how to do that. So this initiative is really around getting things sort of a one-stop shop for home modifications. So I am going to turn it to Adam Schafer, who is the Deputy Director of the Division of Housing and Stabilization at the Massachusetts Department of, I'm so sorry, my home phone is ringing and it's a courtesy call. I really apologize for that. Adam, I'm going to start again. Adam Schafer is the Deputy Director of the Division of Housing Stabilization at the Massachusetts Department of Housing and Community Development.
Great, thanks, Susan. Hi, everyone. My name is Adam Schafer. Again, I work at the Department of Housing and Community Development in Massachusetts. We aid in the development of affordable housing, including permanent supportive housing for formerly homeless families and individuals. DHCD also administers some federal rental assistance, including emergency rental assistance through the ARPA bill, as well as some state-aided public housing. And my division in particular oversees the state's family shelter systems, individual shelter system, as well as our eviction prevention work. So I want to talk today about 2 kind of big picture goals that I've been working on with Emily and Susan and their colleagues at EOHHS. So first, our goal is to triage the most intensive interventions to the individuals or families that have the highest need and who might pose the highest cost to the Commonwealth. And 2, to coordinate client resources and kind of our back office tools to make sure that housing and healthcare are working in concert and not in silos. And prior to this, my work at DHCD, I was working at the state's budget office, administration, and finance, which has really kind of encouraged us to take this kind of whole of government, whole of person approach and really coordinate across agencies to make our interventions as successful as possible. So to start, I'm going to talk a little bit about how we're triaging those interventions. So in particular, we are lucky in Massachusetts to have our own state rental voucher program called MRVP. And in most years, though this is not most years, but in most years, we have a limited number of vouchers available and focused those in the last year, focused a specific number of 45 vouchers to households in our family shelter system who have a chronic condition. So we focus these vouchers for households where one or more family member had a chronic condition, which we defined as 2 specialists with an issue that extended longer than 3 months and may get worse, or received inpatient psychiatric care, or had chronic acute physical or mental impairment requiring special care. We felt like targeting our MRVP resources to these folks was particularly important during COVID because of the high risk of COVID transmission in shelter, and also the need to really provide these households housing stability. And just to confirm, folks, no slides from the Massachusetts team today. We're just talking today. Through this program, we received 250 referrals and randomized them to the top 45, and we'll be issuing some more through a similar process through our Emergency Housing Voucher, or EHV, initiative. But like others have said, and as Lori mentioned in the intro, we continue to have a challenge around available units. Some of the keys to success in this we found were engaging with attorneys early around fair housing and engaging with folks like Emily and other health and housing experts. We also had a similar process for dedicating specific vouchers to families in the child welfare system. So the second goal I wanted to talk about was how we're working to coordinate client resources and back office tools to ensure that housing and healthcare are working in concert and not in silos. So specifically, even before the pandemic, but particularly during the pandemic, we had considerable inflow into our shelter systems from what we call upstream systems of care. So psychiatric facilities, hospitals, substance use treatment centers, and found that some of these folks who were entering shelter, if we coordinated a little bit better, might be able to avoid an instance of homelessness. This was particularly important during COVID when we had limited shelter beds available. So we did a few things to help make sure that our partners in the health and human services space and in the hospitals had the tools that they need to make sure that folks in their care were being referred to the right housing resources. So specifically, we created a decision tree for hospital staff so they would know how to refer their patients to non-shelter resources, such as helping them connect with a skilled nursing facility, for example, or if somebody was in public housing and then spent a long time in the hospital, to make sure that they didn't lose their public housing unit when they were out for some time and may not be able to pay their rent. We also changed and clarified our expectations for shelters to make sure that shelters knew to expect a call from a hospital when they had a shelter client there, and so that the shelter and the hospital could work together and coordinate care for these individuals. We also worked to make clear that late night drop-offs from hospitals were really not acceptable. That wasn't a way for us to be able to best receive individuals who are leaving hospitals. Some of this work, as Susan mentioned, was funded through the Section 9817 ARPA funds for hospitals interested in enhancing their skills and really building up that capacity. A lot of this also was work that Emily and I and some of our colleagues did to really make expectations clear, both on the shelter side and on the hospital side, so that we were all working together and had understanding of where pain points were. And as Emily mentioned, certainly a work in progress, but we're hearing kind of positive things that this communication between healthcare settings and shelters is really improving care for our shared clients. We also created a feedback loop to understand when things didn't go exactly according to plan, and created a reporting form so that we could dive into more data on, so shelters could report when they had what we would call an inappropriate discharge, a discharge from a hospital to a shelter that we thought was not appropriate, so that we could learn from that and create better systems moving forward. Then the last piece I want to mention is really around what I call nailing the little stuff. With the emergency rental assistance funding that we received, it was incredibly important for us to validate income rapidly. And here, again, speaking to what Emily mentioned earlier, because of our coordination between DHCD and EOHHS, we were able to quickly set up a system for us to use Mass Health, the state's Medicaid system, as a proxy for proof of income. So if somebody was receiving income or receiving insurance through Mass Health, we assumed that we made them what we call presumptively eligible for emergency rental assistance, which sped up our ability to serve folks in need of rental assistance to help avoid eviction, and made sure that we were serving our shared clients between Mass Health and DHCD. So with that, we'll turn it back over to Lori. And again, thank you all for taking the time.
Thank you, Adam, Susan, and Emily. Wow, that was jam-packed with lots of great information. I really liked what Emily was sharing about partnership really takes patience and cultivation. It was great to hear what you all shared, and we will be making the recording available, as well as we'll copy the chat too and share that. I know there was some chatter in the chat about that, so we'll share that with you. If you're not able to copy it and save it now, we'll put it in the notes that we make available. So before we move into hearing from our colleagues in Washington State, we want to hear from all of you, and you all are doing a great job at using the chat and sending the questions in, and we will take questions after we hear from Washington State. But in the chat, please tell us your most effective ways of developing strong relationships with an organization who's in a different sector than the one you're in. So if you take a few minutes and think about, like, what are some of the effective ways to develop strong relationships with other organizations that are in different sectors? One strategy from Tashima is identify common goals. Thank you. Let's see. In-office trainings, identifying shared goals and collaborate on solutions. Networking at conferences and trainings, cross trainings. Bring the value of your sector. A collective impact framework. This is great. These are great ideas and great strategies. Taking time before a crisis to understand each other. Meeting regularly, mutual appreciation. Wonderful. Understanding what is possible or not possible from an agency. Meet them where they are, reaching out and connecting. That's terrific. We'll keep these strategies flowing in the chat. And thank you so much for sharing them. I think we all get to learn from each other's experiences and wisdom. So many thanks. Now it's my distinct honor to introduce Miss Whitney Joy Howard, who is the lead supportive housing program manager for Home and Community Services in Washington State Department of Social and Health Services. Whitney Joy, can you tell us about partnerships and innovations occurring in Washington State?
Yes, thank you. Good morning, everyone, and thank you for joining us all today. As Lori stated, I am Whitney Joy Howard, and I am the Aging and Long-Term Support Administration, or Altsa's lead supportive housing program manager here in Washington State. I've worked for Altsa for the past 5 years. Prior to that, I was the director of training for Pathways to Housing National, working throughout North America to assist agencies and communities create high-quality supportive housing programs. I also have a variety of direct service experience related to housing and outreach among the unhoused on both the East and West Coasts. I have the honor today of presenting in partnership with a couple of Altsa's partners. Pam Parr is the executive director of the Spokane Housing Authority, and Alexa Whitted is the manager of Altsa's Governor's Opportunity for Supportive Housing, or GOSH, and Community Choice Guide Services with Consistent Care, a community agency which serves most of Washington State. Next. As some table setting, on this slide, you'll find Altsa's vision, mission, and values. I'm fortunate to be working in a state with a long history of supporting people in the community because a lot of the basics are already in place. But when it comes to independent housing, we find that we need to look deeper for more solutions to ensure our services are responsive to the evolving needs of our clients and the community. When we identify gaps, we do our best to create or partner around services or resources to fill those gaps. And of course, there's always more work to be done. Next. So drilling down a bit into the Home and Community Services Division's philosophy, people are living longer. The population of persons over the age of 65 is rapidly growing. Washington was also a Medicaid expansion state, so we have more younger individuals with complex care needs eligible for long-term services and supports. We know that most people want to live as independently as possible for as long as possible and age in place. Altsa believes that individuals with high care needs can be supported in the community with the right array of services and supports. There are almost always alternatives to institutionalization. We have been helping people transition from skilled nursing facilities and hospitals for over 30 years by building and expanding upon the services and resources available to promote and support individual choice. As you'll hear in this presentation, we partner with community and state agencies to leverage our ability to meet our goal of providing long-term care services in the least restrictive setting while honoring individual choice. Next. Speaking of supporting individuals with complex high care needs in the least restrictive settings, almost like I made this PowerPoint, here's a graph with a snapshot of Altsa's clients by their functional assessment acuity group and the setting in which they are receiving services. The darkest pink is the highest acuity clients with more challenging medical conditions and high care needs. This graph shows that even with high acuity, complex medical needs, we are able to support individuals in their own homes. Next. The Altsa housing team has been up and running since 2011 via the Money Follows the Person demonstration. The housing team was created to support independent housing options for Altsa clients statewide. Earlier, I mentioned some of my work background. Most of our housing team has background in the world of affordable housing and are now part of the long-term care world. And having this experience really helps us bridge these two worlds. To date, our team consists of 15 people who work to create, grow, and administer housing resources and quality supportive housing services for Altsa eligible clients statewide. This is done through networking, collaborating with community and state entities, providing education on services and supports available through the long-term care system in Washington, direct processing of housing subsidies and supportive housing referrals from our case managers, providing education and technical assistance to our case managers on a variety of housing related issues, and as acting as translators between the world of affordable housing and the world of long-term care services. Next. In our work of being mindful of the growing and changing needs of our participants and expanding upon our services to meet those needs, in 2019, we created a new position to expand our work. Having housing subsidies and tenancy sustaining services for those who need them are crucial factors in supporting independent housing for our clients, but subsidies and support services are not tangible housing. Even with these resources, there are great challenges to securing affordable housing, especially if someone faces additional barriers to housing like a past eviction, criminal history, poor rental or credit history. Our housing capacity program manager supports the need for immediate tangible housing to pair with our state subsidies and services. This position has leaned on existing partnerships Altsa has created and has developed and grown new ones. The partnership's braid needed services and subsidy funding through HCS with tangible housing via set-asides from housing developers, nonprofits, and property management companies. These are not project-based arrangements for our clients. Participants are able to take their housing subsidy and move elsewhere. The housing capacity efforts also continue to honor community integration efforts of our work by ensuring a diverse portfolio of set-asides across the state. Next. Part of the way we increase housing resources for Altsa clients is by building partnerships with a collection of housing providers and agencies across Washington. We work in partnership with the Healthcare Authority and managed care organizations to build cross-sector teams that wrap around support. So think our housing subsidy, our long-term care services, and then like assertive community treatment teams via the behavioral health system. We work with the Department of Commerce to ensure those with long-term care needs are considered when creating eligibility for their housing resources and subsidies. One partnership to specifically call out is with the Spokane Housing Authority, who administers all of our state-funded Altsa subsidies under one statewide contract. As part of this effort, Spokane Housing Authority has also partnered with all of the public housing authorities across Washington to conduct local housing quality standard inspections as part of our lease-up requirements. Next. Our team has partnered with various public housing authorities throughout Washington to secure direct access to specific federal vouchers, such as non-elderly disabled and mainstream vouchers. As new or additional federal vouchers get issued, we build upon these established relationships to secure access to additional vouchers, such as the recent emergency housing vouchers. We have partnered with the Department of Commerce to secure direct access to various 811 project-based vouchers throughout Washington. We have brochures on each of these resources on our website, and hyperlinks to the specific brochures related to these federal voucher options are going to be dropped in the chat. Next. The state-funded Altsa subsidy program was launched in 2012 as part of our Roads to Community Living demonstration program and was modeled off the federal tenant-based housing choice voucher program. Altsa rental subsidies are intended to support individuals moving from institution to community settings. We are also able to support individuals diverting from our state psychiatric hospitals. These subsidies assist clients quickly transition into housing while they remain on wait lists for permanent affordable housing. Altsa contracts with the Spokane Housing Authority to issue, track, and monitor these subsidy payments to landlords in order to help streamline the process. And with that, I will turn the presentation over to the Executive Director of the Spokane Housing Authority, Pam Parr.
Hello, everybody, and thanks for joining us today. I'm super excited to present with my wonderful statewide partners. In Washington State, there are 46 separate housing authorities spanning 39 counties, and so some of those are in cities and some are countywide. In our case, we actually cover 6 counties in Eastern Washington, which is about 1/5 of the state. Housing authorities are generally quasi-governmental agencies that provide affordable housing for families, children, seniors, veterans, and people with disabilities. We kind of see ourselves as important business partners in each community. We're contributing millions of dollars to our neighborhoods and to local landlords through rental subsidies. In addition, most housing authorities have portfolios of affordable housing units. And we partner pretty exclusively with, thousands of landlords across the state. Next slide. Okay, so Spokane Housing, you're kind of wondering, I'm sure, why the Spokane Housing Authority is administering a statewide program. Several years ago, Altsa came to the Association of Washington Housing Authorities and wanted to do a pilot of this rental assistance program using state dollars to do it. And at the time, it was a small pilot. It was $130,000 for a 2-year grant. I was the only one that said yes. And so then I convinced all of my compatriots across the state to enter into interlocal agreements with us so that we could administer subsidies all over the state, and we would have them do the inspections. that program that started, what was it, maybe 5 years ago, Whitney, at $130,000, we just signed an $8 million 3-year contract. So clearly it's successful and we are still doing it statewide. My motto at Spokane Housing Authority really is that I'd rather ask for forgiveness than permission. So I hope you all think that way, because that's how you're going to get ahead. And we want to really think outside the box. We want to collaborate. We want to braid funding together and look for loopholes to get the things done in our local communities that we really need to get done. And this program does that. It's amazing. Not everybody thinks that way. This program actually really closely mirrors some of the other programs we do on a local basis. We have something called a referral voucher program where we partner with local nonprofits and government agencies, and Altsa is one of those agencies, where we use tenant-based vouchers from our voucher pool and pair it with services. And that works really well. Those kinds of innovations are the things that really address local need and get things done. Next slide. Should have said that earlier. I think that the bottom line for me is that when someone comes to me and asks me, do you think this would work or that would work? And we brainstorm. When we brainstorm together, that's where the best solutions come from. By using every funding source that you can and every partner that you can work with, you can come up with those solutions to supplement the HUD subsidies that are available. If 1 in 4 people is eligible to get affordable housing, then what are the other 3 folks doing? And so it's up to us to come up with those solutions. Next slide. I think I'm going to turn it over to Alex.
I'm actually going to jump back in here.
Okay.
Thank you, Pam.
Thanks.
Yeah, we greatly appreciate our partnership with Spokane Housing Authority and their ability to be flexible with us, especially with our state funded subsidy. We can be a bit more flexible around our policies since it is not a HUD federal voucher, and we greatly appreciate Spokane Housing Authority being right there with us. What is supportive housing through Altsa? So the term supportive housing is intended to mean one thing, but it can mean a variety of things at this point across the country. Supportive housing was initially developed to serve people experiencing homelessness with complex needs who face challenges securing or maintaining independent housing. At Altsa, we offer supportive housing to expand upon housing choice for clients who want to live independently, but need that additional ongoing support to do so. We utilize a scattered site model in which the supportive housing provider searches for market rate apartments integrated in the community. And most often the participants are utilizing our Altsa rental subsidy to afford those apartments. And now I'm going to turn it over to Alexa Whitted of Consistent Care and let her speak from a provider perspective.
Hi, just as Whitney Joy said, my name is Alexa Whitted. I work for Consistent Care, and we are a supportive housing provider for the state of Washington, and I'm the manager for Consistent Care. So I'm really excited to talk to you guys about the GOSH program because it really fills a need in our community filled with mental health clients. And so it's just a fantastic program that I think many other states should have. So this is the supportive housing coordinating system of care. The supportive housing provider acts as the point person for the participant and helps to drive collaboration across systems and providers. So our GOSH participant would be the one in the middle. And then we kind of work around and are kind of the lead to get the client housed as quickly as possible. And then around the center, we have the rest of the important contacts as well. At the top, the Home and Community Services Case Manager plays a vital part in the pre-tenancy phase, and then it will switch to the AAA or Area Agency on Aging once the client is housed independently. Also very important to the participants' care are the caregiving agencies that assist clients with many daily living needs. We also have informal supports like family. In housing, we have landlords and property managers. Sometimes there's employment involved as well. We have MCO liaisons that help with connecting participants to services like mental health providers and primary care providers. A very important part of the client's care is the outpatient and behavioral health providers that usually consist of clinicians and prescribers. In our clients that have co-occurring disorders such as mental health and chemical dependency, we collaborate with SUD services. And finally, with primary care providers, we can help support our participants' health. And who's in this diagram can change over time. And so it changes based on where the client is in their housing process. Next slide, please. And then what is supportive housing? There are other supportive housing opportunities available, but this is specific to GOSH. It is philosophy program and evidence-based. It keeps the individual centered in the process. It utilizes harm reduction and proactive engagement. And the participant has access to weekly home visits and 24/7 access to their support housing provider. We usually play a YouTube video here, but we aren't able to share it today. But we will post it in the chat box. So if you will see it in the chat box, the video is about chronic homelessness and uses the Housing First model. Next slide, please. So for pre-tenancy services, the GOSH services provides, we develop an individual housing support plan, housing crisis plan. We conduct and search for secure, affordable, independent housing. We review leases and landlord tenant laws and always being a housing advocate for the clients. We assist participant moving into housing, and we coordinate with the participant's care team. It is important to note that as a housing provider, we strive to really advocate for the client as much as possible. This can include helping clients in a multitude of different ways. An example I'd like to share is that we had a client with a very predatory previous landlord and had assigned our client their previous tenant with $10,000 of damages. The case manager of the team decided to follow up with the landlord and asked to see the damages since it didn't seem right. She was able to work with our local Northwest Justice Project, their attorneys that donate their time, and we were able to get the amount significantly reduced and therefore make it more manageable for the client to pay the damages and therefore get the collection removed, and we were able to rehouse the client. So some of our jobs, we kind of just do whatever we need to do to get the client housed, and whatever barriers are in our way, we really try to problem solve as a team and come together for the client and get them housed. Next slide, please. And then other services that we provide, we proactively support maintenance of tenancy, the relationship building with landlords, property managers, and neighbors. Sometimes we have clients that have some unsavory behaviors, so we try to work with them and say, hey, this is not exactly everybody's happy with it, so how can we problem solve and work through this so that we can make everybody happy in this situation? We always ensure person-centered housing support and crisis plans that are up to date. A huge component of this program is it really being person-centered. We have to let the clients make their choices because if we try to make them for them, most of the time they're not going to be successful because it's not what the client wants. So we always just try to educate them on all the options possible and then let them make their choice. Coordination with participants' care team, including coordination of authorized services. Activities that support for community integration and connection to permanent affordable housing. So this voucher is such a fantastic voucher, but we do try to get our clients onto long-term subsidies and subsidized housing. In this portion of the support, our goal with Consistent Care is to really support the client in whatever way possible for them to be successful in the community. Sometimes it looks like supporting the client with staying connected with mental health services or helping to support their goals with substance abuse. We try to build as much rapport with the participant and help them feel empowered and supported every step of the way. Next slide, please. And then long-term services and supports for community services supporting housing. Services that assist, secure, and maintain an apartment. A background check, we pull the background checks prior to applying for units to determine what unknown barriers that the client has. We fill out a lot of rental applications. So we search and we apply for properties until we are successful at getting the client approved. There could be many hoops for jumping through and getting the client approved, and working with landlords on different tenant laws. Some landlords like to kind of fight us and make sure that we're trying to do 2 or 3 times the rental amount. And so just providing some education to landlords and letting them know our client has a voucher. So, you know, their percent that they pay is only 30%. So therefore you can only do 2 or 3 times their paid amount, not what the actual cost of the rental is. So we do have to provide education on that and a couple other things. We are able to pay for move-in deposits, which is very, very helpful. We can pay up to double security deposits for some clients that have poor rental history, evictions, or bad credit history. We are also able to provide first month's rent until the Spokane Housing Authority, they kick in and then they start it from the 2nd month. And then we can also pay for moving services. Essential items that we're also able to pay for, which includes furniture, clothing, cooking supplies, cleaning supplies. If the client doesn't have their food card working yet, sometimes it takes about a week to kick in. We can also pay for a first week of food for the client. And really any other kind of things that pop up, also like cell phones or bus passes. And then certain services to keep the client housed could be like pest eradication or like a deep cleaning. Next slide, please.
And I'll chime back in here. So the resources Alexa was just referring to are services that are actually built up as part of our long-term services and supports package available to clients in Washington eligible for long-term care services. They really complement our supportive housing services and support individuals who want to live independently but have financial barriers to doing so. And in addition to those resources, we also have created some others to support tenancy. So we've discussed our Altsa housing subsidy. I did also want to make note, we have a state-funded emergency rental assistance program in which long-term care clients who don't have access to any other emergency rental assistance are able, if they get behind on rent for whatever reason, owe a ton of money to their landlord that they cannot possibly pay off, but they do have the ability to pay their portion of rent ongoing. We actually can, through our emergency rental assistance state-funded program, pay off that kind of lump sum amount to stabilize and sustain that tenancy. We also have community choice guides. This is a service that predates our supportive housing services, and community choice guides are essentially housing specialists. Our case managers can authorize them to support a client's housing search process, help fill out applications, get somebody into housing, and then oftentimes the community choice guide services go away. So that's a difference between our supportive housing service, which is ongoing tenancy support as well, and our community choice guide service for someone who just needs financial assistance and help searching for housing. And then some additional services that we have built up through our long-term care system to help sustain tenancy are behavioral support services. This is separate than our behavioral health system in Washington. These are just targeted behavioral support services through the long-term care system to stabilize tenancy, some technical assistance funds, and some other professional support services. Next. And then here are just some resources through Altsa. We have our long-term care manual with our services and resources detailed in the various chapters. So I added some hyperlinks to some relevant chapters. And then those specific to housing and supportive housing resources. We've also built up a web page, a few web pages actually, and have put a lot of great educational material and useful resources on that website as well. So this will all be sent out to everyone. You can find the videos that were shared in the chat and the brochures and some other information on our website. Thank you so much. We also have our contact information on that website, and we're happy to talk with you about any of these resources.
Thank you, Whitney, Joy, Pam, and Alexa. This has really been chock full of lots of great information. You know, you highlighted a few things about housing subsidies going with the person. I think, Pam, you were talking about ask for forgiveness, not permission. It certainly paid off from a $130,000 initiative to an $8 million initiative. So good idea to take risks there. And then we also got to hear about pre-tenancy supports and services. And those were just a few of the things. But we'd like to hear from all of you right now. So if in the chat, you could share what new ideas did you get from the Massachusetts and Washington presenters today? Drop your ideas in the chat, please. Ask for forgiveness and go for it. That's right, Jean. Where to look for partnerships, previously unknown resources, build relationships, cross-sector teams. I know people want to hear more about how services were paired with vouchers under home and community-based services, possible funding sources. These are great. Make an inventory and try to connect all of us in CAPS. Strategic use of ARPA funds. These are really great takeaways. Grading fundings and programs and thinking out of the box. Strategies to get the landlord to stop charging 3 times the rent. I think Alexa shared some information about that. And while you're all responding, and keep these ideas coming, I think it helps for other people hear or see what others are seeing as takeaways. And while we're doing that, we're going to go ahead and have all the presenters turn their cameras on so we can move into our questions and answers. But please keep your ideas coming in the chat. And just another call, if you do have some questions that you'd like to ask the presenters, many of you have already started putting them into the Q&A section of the Zoom platform, but please go ahead and enter more of them in that area, and we'll try to answer as many as we can during the session. Those that we are unable to answer, we'll put on our frequently asked questions document and get answers back to people. So let's start with this first question that's come up a few times. And Emily, maybe we could direct this one to you. How did you pair housing supports with a voucher?
So that's a good question. I'm going to do it answer it jointly with Adam. We have actually an 1115 waiver that sometimes called DISRIP, that allowed us to create accountable care organizations and allowed us to create something called flexible services, which is an initiative that provides housing related supports, doesn't pay for the rent, but it will help you with housing search. It'll help you with move-in assistance. It'll help you with costs related to moving into housing and all those things. And it will also help you stabilize in that housing so that you don't become homeless or homeless again if you were homeless prior to that. We approached the Department of Housing and Community Development. We said, you know, this program's great, but folks have access to the services, but there's no housing out there. Would you like to try something small? So we have a small program, and Adam, I'm going to look at you. It's state-funded vouchers that are directed to people who receive Medicaid-funded services that were enabled through an 1115 waiver. This isn't the first time we've partnered. We definitely have partnered in the past with our MFP program, and the Department of Housing and Community Development had Section 811 or Section 8 vouchers that were for that to move people out of nursing homes. And then lastly, we currently have a pilot going on using, again, state-funded vouchers to move people out of nursing homes who are younger and disabled. So I'm not sure exactly. I mean, it was just sort of like, hey, we have these services. Hey, we have these people. Do you think we could have some vouchers? Let's try it out. Adam, is there anything I missed?
No, I think that captures it all.
Thank you. And let's move on then. We have another question. I have a client who has a voucher and needs a handicapped accessible apartment or housing. She has been struggling with finding a suitable place. What are tips in assisting with finding suitable handicap accessible housing? And then they offer in parentheses, there are usually none available or only for people over 62 when my client is under age 62. Any strategies or ideas from anyone? Does anyone want to jump in on that one? Alexa, I was thinking maybe this is one you could start with.
Yeah, no problem. This is always a really big struggle, and first floor units are always really hard as well, just because there's not a lot available. Typically what I would do in those cases is I worked in Washington. I did housing searches in Snohomish County, and I just built really good relationships with property management companies and landlords, and basically got on their good side to where I would say, hey, you know, I have a client that's looking for this. When one pops up, can you guys put me down for it and put me first on your list? And the way that I was able to build good relationships is when issues came up with clients, or just making sure and checking in with them every couple of weeks saying, hey, how's things going with this client? And it really built good rapport that I was there, whatever they needed, whatever issues that they had. That would be my primary, is really just calling all of the different companies and saying, hey, I have a client. I don't think legally they can hold and say, you can't have this handicap ADU, can't hold it against because the client's not of age. So I don't think that is legal. So they should be able to try to maybe hold one. And typically they don't give out those units to just anybody. They usually have to reserve them for clients that need them. I hope that helps.
That is helpful. I saw there was some additional information coming through on the chat. There was a recently enacted law in Oregon called FAIR that someone shared to help with issues like this. And then I saw, Emily, you shared something about a database in Massachusetts.
Yeah, we have an affordable housing search program. And if you go to that link, it'll list the affordable housing. It'll also list the accessibility features of that affordable housing, whether the waiting list is open and things like that. We also use Medicaid funds routinely to make home modifications and have a statewide home modification loan program. I know that we still have issues that come up, but we try and solve them individually, if possible, by modifying a particular unit.
So I'm going to chime in here. If this client has a voucher, something that maybe is not commonly known. Housing authorities can actually use HUD funds to make handicap modifications to units. So if they have a voucher, you might inquire with the housing authority about that. It's not something that happens a lot, but it's definitely an eligible use of HUD funds.
I will just add one additional thing that's not exactly helpful for the question at hand, but thinking longer term, our housing capacity work, that is having somebody work kind of with housing developers earlier on in the process. And what that's done is created relationships and networks and put Altsa in good standing with some of these developers. So when they have design questions or when they're developing buildings, we can actually support the process to help create more ADA units, since that is a huge need with our population. So that's something kind of more bigger picture, those relationships kind of help toward that process as well.
Thank you all. That was a great answers to those questions. I think we also have another question around, and it's sort of related to this one. So I don't know if there's anything more to add, but what kind of education is provided to local housing authorities and landlords regarding why they should seek more vouchers or accept tenants with vouchers? I guess it's not exactly related to the last one, but and then did you have any hesitancy or stigma issues? And if so, how did you resolve them?
I can address the housing authority portion of that question. And I will tell you that housing authorities across the country do not operate the way that housing authorities do in Washington state. Many of them are more regulatory in nature, and they do what they have to, but don't think too much outside the box. And so I think it's about relationship building. Make sure that you are reaching out to that housing authority, building a relationship. And the easiest way to do that is to bring value to the conversation. So what can you bring to the conversation as far as value goes to help build that relationship, and build that relationship when you don't need something? That's so important, because then later when you do need something, you can call. You've already got a relationship in place. So a lot of networking, a lot of relationship building, so that when you do need something, it's already there.
Thank you, Pam. Anyone else want to chime in on that question? Okay. The next question is, how are the supportive services funded? Many of you were talking a little bit about connecting people up to supportive services that helps people either get connected to the services they need to live in the community, or get connected to the services they need when they're in housing so they can stay housed. How are those supportive services funded? What are some strategies on how they're funded?
So I think we use a variety of resources in Massachusetts. So we definitely have funding that comes from the state. So for example, I'll turn it over to Adam in a sec to talk about if you're a homeless family, what's provided. But in Massachusetts, we do rely a fair amount on Medicaid funded resources for some of this, and also on HUD resources, particularly as they relate to people who are experiencing homelessness. Adam, do you want to talk a little bit about our system for homeless families?
Sure. So for homeless families who are in our family shelter system or our emergency assistance system, when they exit, they're entitled to most receive 1 year, and hopefully starting next year, 2 years of support through a program called Home Base, which is like a rapid rehousing program, which couples financial support to cover part of the rent as folks are leaving shelter, as well as what we call stabilization support services, so kind of tenancy maintaining services. Then on our individual shelter side, we're trying something a little bit new in creating our housing through a single procurement for sponsor-based permanent supportive housing. So we were having, I think one of the challenges that we have is coupling together those housing resources and the support services and having them work well together. So we tried actually something a little bit new and just advocated and secured a dedicated funding for our providers to go out, master lease buildings, and then sublease those units to formerly homeless individuals. And through that program, we're going to be funding both the housing and a good chunk of the support services. We're encouraging our providers to go out and try to draw down additional services or additional dollars, like the dollars that Emily was talking about from Medicaid, but we wanted to build something up really quickly that didn't require actual brick and mortar building, that didn't require coupling together a ton of different sources. So went out, we have a new $5 million line item that, knock on wood, will be recurring so that we can kind of have that all in pretty close to one package.
That's terrific. And Alexa, would you be able to respond to like what pool of money funds community services supporting housing? Can you talk a little bit to that?
Yeah, no problem. So our GOSH program is funded through DSHS, our state funding, and they have multiple different funding sources, different programs, depending on what the client qualifies for. But yeah, all of our funding comes from the state. So Whitney Joy might be able to touch a little bit more on each one of those programs.
Yeah, I'm sorry, I got kicked off for a second there. So our governor's opportunity for supportive housing, GOSH, which is specific to individuals exiting or discharging our state psychiatric hospitals, those supportive housing services and the subsidy are 100% state funded at this point. In Washington, we also have an 1115 waiver that has various initiatives, and one is supportive housing and supported employment benefits. So there's a larger population of individuals in Washington who have access to supportive housing services via the Medicaid benefit. Through the long-term care system, we also utilize our state plans and waiver programs to kind of piece together between state dollars and Medicaid dollars, various supports and services. At this time, the other than our state partnerships around the federal vouchers, our Altsa subsidy is 100% state funded.
That's helpful. Does anyone have any other funding sources they wanted to share before we move on to the next question? Okay. So this next question is around, does the individual housing support plan tenancy services help individuals with transportation? Is there anyone to show options and how to get to other health services, education, employment, and engagement in the community? Emily, I see you took your mute off. You want to go first?
I was going to say that we cover transportation under different things. So again, and under 1115 waiver, if you qualify there, you get transportation to housing stuff, to nutrition stuff. And Susan, can you talk about for either the DSNPs or whatnot, what we cover for transportation in there?
Sure. So as a Medicaid covered benefit, we do cover transportation to medical appointments, but some of our DSNPs and our MMPs, which are the dual demo programs, cover also social transportation. It's limited. It's something that they cover as a supplemental benefit, but it's incredibly useful to folks.
And for Washington State, we have the Medicaid broker HopeLink in multiple places along the I-5, and our GOSH supportive housing program. But we are actually able to transport our clients. So if they're not able to get a HopeLink, a Medicaid broker service to pick them up, we can take them and to do different community events, take them shopping, take them to doctor's appointments, take them to a shelter to, rescue an animal. I mean, just it's kind of vast on whatever they need. And then we also we try to have front line is to have a caregiver so that the caregiver can do like grocery shopping and stuff every single week and have like a schedule with the client. So caregiving service is probably our first, and then we're kind of second.
I'm doing some chatting with Adam. I think our shelters have access to transportation resources, particularly if it's to divert someone from becoming homeless and entering the shelter. So for example, if the person needed a bus ticket to go reunify with their family. Did I get that right, Adam?
Yep, that's right.
So there's different thinking about transportation a little bit differently.
That's interesting. We found with some of the self-directed programs too, trying to think about how people get transportation and who they can arrange it with or buy it from. There's like lots of strategies around that. You really have to be thinking out of the box, like a lot of you are talking about. Yeah, I also might just add that the Coordinating Council on Access and Mobility has a braiding guide where states and communities can braid together federal funding with FTA Section 5310 and 5311 funds and Older Americans Act or Centers for Independent Living Rehab Act funds that are spent on transportation to really expand access to transportation services. So we can also share with people that resource and make it available. So we've got time. Oh, go ahead.
I just wanted to add one other thing. In terms of thinking about supportive housing services and transportation with client present being billable, there is a ton of amazing support that happens in car rides with clients. So that is definitely something that we want our providers doing and definitely want to be able to bill to support that service.
Terrific. Whitney Joy, thank you for sharing that. So we have a question. Well, we had a couple questions coming in about money follows the person. So could you all speak a little bit about how you're leveraging housing vouchers and supportive services to help people transition out of institutions, or how the Money Follows the Person's program has been helpful in this area?
For the GOSH program, it has been absolutely imperative to be able to have the money connected to the client. There's a lot of, it costs a lot, especially in Washington State, to move into an apartment. I mean, the rent over here for a 1-bedroom is $1,500. So by the time you add first month's rent, security deposit, sometimes last month's rent, you're getting into quite a bit of money there. And a lot of our clients that are coming out of Western Eastern state hospitalizations, they don't have anything. Sometimes they just have what they're wearing, and that is it. And so they really need a lot of resources to get started and to be successful, because if you just put somebody in an apartment with nothing, they're not going to be very successful. There's a lot that goes into being successfully placed in independent housing. And so our funds are imperative for that process.
In Washington, and I'm sure this is the same throughout the country, in terms of people who are currently in institutional settings, they're often cut off from the local coordinated entry systems. So when they are, extremely low income and in need of housing resources and exiting either a skilled nursing facility, long-term acute care hospital, our state psychiatric hospitals, they don't actually have access to any of the housing resources through coordinated entry. So our state funded Altsa subsidy that serves both GOSH and individuals exiting skilled nursing facilities is really imperative to be able to get people quickly into their own homes and have the financial support to be able to maintain that housing.
Yeah, thank you. In Massachusetts, we actually have 2 MFP waivers that we transitioned from the MFP demo. One is a community living waiver. Again, partnerships with housing and getting housing vouchers are absolutely essential to move folks from facility settings to the community, specifically for the MFP community living waiver. We are also in the process of reactivating the MFP demonstration. So it'll be extra confusing. We'll have 3 programs with the same acronym here in Massachusetts, all aiming to move people from institutional settings to community settings, all with a little bit of different services, but with the goal of getting people housed in their communities, and absolutely partnering with folks at DHCD to make sure we can get vouchers for people who need them.
The other thing to remember is that in the last 2 years, most housing authorities have gotten mainstream vouchers, and those mainstream vouchers are targeted at that specific population. So there should be some, some arrangement or relationship there with the housing authority to get mainstream vouchers out to those folks.
So I also just want to add that in Massachusetts, as I'm sure is the case in other states, vouchers are great, but we're having a really hard time finding places to rent. So lots of people are getting vouchers. So we're thinking about the strategies on both sides. So in addition to vouchers, we are, as part of our affordable housing development, we have programs that are specifically designed to create housing where a handful of the units would be for somebody transitioning out of a nursing home. And that's a state program called community-based housing. We've had that on the books for a while, and we've combined it with the Section 811 resources and other resources to continue to bring online affordable, accessible housing. Probably not enough, but at least, trying to make a dent in not just flooding the private marketplace.
We've also project-based some of our state mobile vouchers, so that as the EHVs came in, we decided to project-base our state vouchers so that we could support more development projects, get more building, particularly units that are for permanent supported housing for formerly homeless or chronically homeless individuals, folks everyone is struggling in the Massachusetts market right now, but particularly people with perhaps a more challenging rental history. So by project basing some of those, create a few more units, and then use the EHVs as more of our mobiles in Massachusetts.
And that's our whole housing capacity program manager that whole position was created to address the challenge of having tangible housing in any kind of timely manner. We also recently started talking about sponsor-based. So I will likely be following up with you, Adam, after this presentation. And I also did want to note, in terms of there's a lot of moving pieces in the housing world. So the relationships are really key. Thinking about our GOSH participants and our state psychiatric hospitals, we have to create, or in the community facilities for our diversion folks, it really depends on really great working relationships between our providers and the discharge social workers there, to make sure that we're kind of aligning the discharge process as best we can, so that people are able to discharge into their own homes or to some kind of stable housing setting as they're continuing to work on securing independent housing. We also, I didn't specifically call out the relationships we have built up at Altsa with our low-income housing law advocacy groups, but they are crucial in all of the work we do. Like having someone to quickly call or email and get a quick response to in terms of legal rights of our clients is extremely important. And there are contracts between our low-income housing advocacy groups and our state psychiatric hospital. So there's an additional level of legal support to be able to be leaning in on in our network there.
Well, I want to just take a moment and ask the audience to join me in a virtual round of applause for our speakers. This has been fabulous. Thank you for your leadership, your innovation, sharing your great ideas, and your partnership building strategies with us. And it was great to really have the representation across the different sectors on the speaker panel. So many thanks for your preparation and your and sharing your expertise today. I'd like to also move into some closing. We want to remind everybody that the Housing and Services Resource Center website has a lot to offer you, along with information about the funding opportunities that got mentioned on the first webinar, And we also have some models and partnerships links that are up and some examples that you'll be able to look at there. Again, you can find that by going to the acl.gov/housing and services/models page. If we go on to the next slide, we'd like to ask you to help us. We want to hear your impressions of today so we can improve our webinars. We have a short feedback form in the chat. We'll put the link to the form. Thank you for making a few minutes to share that with us. We do take your input and continue to incorporate it into our planning and approach for the next webinar that we provide. And I also then would like to just remind everybody that if you do have any questions or housing related questions or operational questions that you want to ask of the Housing and Services Resource Center, please email us at hsrc@acl.hhs.gov. Watch for emails from us when the webinar recording and slides are available. And finally, we want to again thank everyone for your participation today. We didn't get to all the questions, but we will generate a frequently asked questions list. I really want to thank all of you for your active participation in the chat, the great questions that you ask. I especially want to thank the speakers that prepared and presented on today's webinar. We want to thank Mission Analytics, US Aging, and the ASL interpreter and our CART specialists for their roles in producing today's webinar. And that will wrap up our webinar. Thank you so much, and you all have a great day.